Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. We're here today down at our retreat in Brooks, Georgia with Mr. Vincent Gita. And Vincent's been a patient of ours for, how long has it been now, Vinny?
About 8 months.
About 8 months. And Vinny and his wife Darlene are from Georgia, and you're from which city? Hampton. And Vinny came to see us with a fairly significant issue. And Vinny, if you tell our audience what was going on with you at the time when you first came to the Goldberg Clinic.
The very first day that I saw Dr. Goldberg was the day after I had my very first chemo treatment for, I had been diagnosed just a few days prior to that with Hodgkin's lymphoma, and had my chemo 4 days later. The next day I saw you for the first time.
How were you feeling at the time when you came in? I know there was significant trauma going on because, number one, you were getting chemotherapy, and the other thing was that you had just received what I would think would be a fairly scary diagnosis.
Yeah, and I was very sick. I remember I had hiccups that wouldn't stop. It was hard to talk to you. Yeah, you're right. There was a lot of concern, anxiety that I had. Because I had just been through 3 different biopsies at the time leading up to getting the diagnosis of the lymphoma, and had also just prior to that also been diagnosed with type 2 diabetes.
You also had diabetes, that's right. And in fact, your diabetes was pretty severe. You had a hemoglobin A1C, which was well over 7, as I recall. Yeah. And that's when we first saw you, and you had decided at that time to go ahead and take a few of the chemotherapy treatments. And there was a series, I think, of 12, am I right, Ben, you were supposed to take?
Yeah, I was supposed to have.
And you went ahead and you proceeded to take how many of those?
I had 5.
You had 5. And what was your experience taking those 5 treatments where they gave you some very toxic agents through infusion into your system?
Each time I got sicker, and each time I probably had a new symptom appear that I didn't have at the previous one. So I went from I had by the time I got to that 5th one, was having chills that wouldn't stop, for hours, shivering. I was constipated. I say it's nauseous, but it's not like any kind of nausea I've ever experienced previous, but it's the best word I can think of to describe it. Kind of an extreme feeling of nausea. I couldn't eat. Couldn't find foods that I like to eat. I like to drink water. I couldn't drink water. I just could not stand the taste of it while I was undergoing that.
Did you feel while you were doing that or afterwards that you were doing something healthful for yourself?
No.
No.
I told my wife at one point, I said, I feel like there's a battle going on between cancer, chemo, and me, and I'm losing.
And you're losing.
Yeah, I just say I was very sick. I got to the point where I honestly also told my wife that I thought I was dying.
Because not only because of the disease, but because of the treatments that you were receiving for them.
Right.
Okay. And at the end of the 5, and I didn't tell you to take them or not to take them, did I?
No.
No. That was purely your decision alone. And at the end of 5 of them, you made the determination on your own or in talking with Darlene, your wife, to stop taking those.
Yeah. Initially, the reason I stopped was I was so sick I couldn't go in.
You really couldn't hack going in for another treatment.
Right.
Yeah.
Right. But then, while I was in that process, I also started thinking, this is not good. I can't continue to do this.
Okay.
I've only taken 5. I have 7 more to go.
Yeah, yeah. You weren't even halfway through them yet.
Right.
Right.
So,
And it didn't feel like you were doing anything that was bringing you closer to a high state of vitality.
no.
No.
I felt like if there was even a possibility that I could have possibly pushed myself through it, I probably wouldn't have made it. I mean, I just wouldn't have made it.
Well, the mechanism of the treatment you were receiving, as is true of virtually all types of conventional cancer treatments in the Western world, is to see the cancer cells as an enemy and to go in there and basically seek and destroy it. And the problem, of course, is what we would call in the military, call it collateral damage. And that is when you destroy cancer cells, you also destroy our own cells. And in effect, really, the cancer cells are our cells, aren't they? Yeah. So you made a decision at that point you came back and we did a workup on you here. And at the end of that workup, I made a recommendation to you to go down to a retreat center in Florida, correct?
That's right.
Right. And you went to the Hippocrates Health Center, and you went down there for how long?
3 weeks.
3 weeks. And what was that experience like for you?
Was life-changing.
Yeah. And somewhat like our own clinic, it's really largely based on education, isn't it?
Yes, it was. I learned things there that seemed to be contrary to what I've been taught all my life.
Mm-hmm. Yeah. And it wasn't just about food, was it?
No, it was about all aspects.
All aspects of living.
Yeah.
Right. And you came back from Hippocrates how long ago?
I came back on December 20.
Right. So you were introduced to using living foods, and you were introduced to getting out in the sun and the fresh air, and you were taught about having good mental attitude, which you actually already did, in my opinion. And you were also in a congenial environment.
Yes.
Yeah. The supportive environment.
Yeah.
And so you really had all the, it was in South Florida to boot, so you were really in an environment that was conducive to what God and nature provide for us, to provide for good health. Yeah.
And you know, you just reminded me of something there when you said what God and nature provide.
Yeah.
You know, before I would let the opportunity to say that, you know, the source for all my healing I see ultimately as being God, and I give Him the thanks and praise and glory for the healing that I've received.
I can understand and appreciate that, certainly. All right. And then you came, and I think having that attitude has been very important in the remarkable improvements that you've had too. Then you came back, and you almost immediately came back and saw us again.
Yeah.
And we modified a few things for you and started you on a program here that was also based not just on what you had done at the good work at Hippocrates, but also based upon the laboratory testing and the analysis that we did on you through physical exam and case history. And then today we're particularly happy because, first of all, how are you feeling right now in terms of your health?
Well, I've been saying I feel better than I have felt in the last 6 months, for sure. And I also am feeling, you know, each day, or you know, it's very small, incremental improvement. But I know each day I'm continuing to feel better. I continue to see to have more energy. You know, make it through my day easier. You know, I'm slowly rebuilding my strength. You know,
Yeah.
But I am rebuilding, and you know, I just feel good. I feel very good.
Can't add much to that. And the important thing is, in all the videos that we've done on so many people, we posted, I think we try to make clear that we never treat diseases. Hippocrates doesn't treat diseases either. I never said I was going to treat your cancer, did I? And I bet you Hippocrates never said that either.
Right. No.
It was going to help make for us. And today we're happy because, particularly happy and joyous because Vinny came in today with Darlene, and he brings his report from his oncologist, who has done some additional studies on him, in this case a CT scan, which does involve some radiation, but understandably Vinny wanted to see where he was at in terms of how much progress he had made, or if there wasn't progress, he wanted to know about that too. And he brought the report today for us. And Vinny, can you read for us what it says here? This is the report from Piedmont Healthcare, from Piedmont Hospital in Atlanta, Georgia. CT tumor, skull to thigh. So they did a complete PET scan on him. And at the end of it, on page 2, it has the impression as the radiologist reads that. And let's just go through this and read for our audience here what you have down here. So what's the first one say?
Dramatic improvement in appearance of nuclear medicine whole body PET CT scan when compared to prior study.
So he had the initial study done some months ago, and they're talking today. When this study was done, which was just February 3rd, just a few days ago. Or was it today? February the 13th. 13th. So this is only 10 days ago. Okay. Read this one here, Benny. What does it say?
Okay. Virtually all of the bulky adenopathy has shown resolution.
Has shown resolution. So all the adenopathy that he had before has cleared up. Number 3.
The spine has shown dramatic regression as well.
The spine, where there was lesions, has also shown that there's regression of these lesions at this point. And it goes on to say other bone lesions seen previously cannot be discriminated today. There are no osteolytic, I'm not embellishing this all, am I?
No.
There are no osteolytic or osteoblastic lesions. There is no pathological fractures. All right, and number 4, there's a small focus of increased tracer uptake in the interior right second rib, no fracture seen, and they're going to do, it says here, we'll do a follow-up on that. So then we look at the osseous system right above, and what does it say here, Benny?
There has been significant improvement in the appearance of the spine since the prior exam.
Okay. There's been significant improvement in the appearance of the spine since the prior exam, dramatic improvement in the appearance of nuclear medicine whole body PET CT scan when compared to prior study. Virtually all of the bulky adenopathy has shown resolution. The spine has shown dramatic regression as well. Would you say that's a pretty, I know you're not a medically trained person, but would you say that that's a pretty good review there?
Yeah, I took it as miraculous.
Yeah. And in addition to that, we also have Vinny studies, our own lab studies, and what did we find out in regards to your diabetes?
My blood glucose levels are now normal.
And we also did a hemoglobin A1C, which measures the amount of glycosylated hemoglobin inside the red blood cell. And that went from over 7 down to under 6, which is now within normal limits. And how much, you were carrying a little extra weight with you, and you've lost how much weight now?
Probably a little over 30 pounds.
A little over 30 pounds. Okay. Do you think you're on the right route now?
Yeah, definitely. One thing I thought of a few minutes ago that I wanted to say about just the experience of the decision to make this change.
Yes.
I told my wife that while I was taking the chemo, we were focused on that and on the side effects that it was causing and how to deal with those. And I said, I want to change that. I want to focus on getting healthy. I want to focus on how sick I am. I want to focus on being healthy. And it's
I think that's a remarkably astute observation. I agree with you entirely that it's important to focus not on the so-called disease, which people have when they're sick, but to focus on all those things that are important in order to recondition our health and provide the conditions that get us healthy again, regardless of what the medical condition is called. Okay, well, Vinny, thanks so much. And we're going to do a follow-up on this in a few months and follow you as you continue on your journey to good health again.
I look forward to it.
Thank you.